Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Modupe. We bring you Sound Health every Tuesday on Lagos Television, and we try to highlight trending health issues from around the world. Earlier this year, the Nursing and Midwifery Council of Nigeria issued new guidelines for nurses in order to get them verified. This is our focus today on the program. Stay tuned. The conversation begins after this break.
Had a slight increase around the 18th, 19th, and 20th, 21st, but as of the 22nd, the numbers have started to come down. And as yesterday, we had, I think, just 1 or 2 cases reported. We're yet to clean up the data from yesterday. But the general trend is that the numbers have significantly reduced, and we're not seeing the numbers of cases as we did before. Beverages are produced in a batch, and once the batch is produced, it is distributed and consumed. So when we go back to a particular location where they are manufacturing street beverages, we may not find anything at all because the batch that was contaminated has been completely distributed. We obviously will pay attention to the source of water that those manufacturers are using, and that is what we're doing at the moment. We're trying to identify as many of these street manufacturers. First of all, we're trying to emphasize the fact that if you're going to manufacture anything for public consumption, you must be registered with NAFDAC. So that will immediately put a very high level of regulation over the manufacture of street beverages.
It's kind of like global. It's not just us. It's the rainy season. It's the climate change. It's everything. And Lagos City is doing everything possible. We've got the right people in the right places, working day and night over the weekend, going to the marketplaces, going to churches, going to mosques, going to obviously schools, inspecting, checking, sampling, doing all sorts of things just to keep us safe.
It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Toby Omolere, a registered nurse, founder and coordinator, Nursing Conception Initiative, and he is going to tell us about the recent nurses verification guidelines by the NMCN. Good evening, Toby Omolere, and thanks for joining us.
Good evening. I'm really excited to be with you this evening. Thank you.
All right, tell us about the recent policy by the Nursing and Midwifery Council of Nigeria for nurses.
In the past, the verification used to be really seamless, and kudos to the new registrar. He made it as seamless as it is currently. He made the whole process online. I remember when I got verified a couple of years ago, it took me about 48 hours to be verified. I did not need, I needed no connection. I did not have to contact anyone. I did it online, and it all went through. And recently, they brought out, it was actually suspended, and then they had new guidelines, and the guidelines were in such a way that it was going to frustrate the ease that we used to experience with the process. Now, the problem with ourselves is we are quite the NMCN has issued you a license, and they've said you are a nurse, and a different body is saying, NMCN, is this person truly a nurse? And the NMCN is saying it should take a number of a period of time, a long period of time, before they can ascertain that somebody that you have issued a license is a nurse. So I mean, it's really confusing. It's frustrating to say the least, and that is why we've had uproars from different angles, from different nurses all over the world. Thank you. I mean, it's just in summary.
Tell us, let viewers know, give us more insight about these recent guidelines. What is it that we have now, the provisions that you need to be verified, and what it used to be?
My MCN is suggesting that you need to have practiced in Nigeria for 2 years before you can be verified as a nurse. MCN is suggesting that your lawyers from the school you have graduated from before you can be verified as a nurse. And there are also rumors from quarters that the fee is going to be increased in multiple folds. I'm not confirming that. I'm just talking about things that have been suggested. So these are some of the things that make it very, very confusing, because how can you ask someone that is given a license as a nurse to go back to his school to go and for verification? I mean, the school that has issued a bachelor's degree or a certificate, you're asking the person to go back to the school before they can be verified as a nurse. So I mean, these things are extremely frustrating. And this is not even about relocation or whatever it is. There are people that sincerely want to further their education, for example, have higher degrees, master's degree, PhD degrees, and these institutions abroad, for example, would want to be sure that I'm reduced by 2 years, or is going to be frustrated by 2 years because they have to go back to they have to have practiced for 2 years, they have to go back to their school to get this from their employer. I mean, it's not in line with the global best practice, and I mean, it's just a bit unfortunate, really.
So, is this provisional guidelines for nurses in Nigeria, or nurses who had foreign training? Nurses who had foreign training.
The NMCN is saying every nurse registered with NMCN. So it includes nurses who are trained in Nigeria. Myself, for example, I was trained in Nigeria, and if I would need to get higher degrees and they want me to be verified, I would need to pass through that process. If I would need to be registered with a different board of nursing in a different country, I would have to pass through that rigorous process. Yeah, so that is the idea.
Okay, according to the Midwifery Council, this procedure is to check the image, restore the image of the profession, and as well as restore, check excesses in the profession. Do you agree with this?
The image of the profession in Nigeria is not threatened by verification. If you would ask me, it is a boost on the image of the profession in Nigeria that other countries find their nurses worthy and qualified to work in their country. So it means you are training very good nurses, and we love them. Please let them come and work with us. And the various issues that are affecting the image of nursing in Nigeria are multifactorial. It includes quackery, for example. If NMCN is very serious about the image of nursing in Nigeria, they should be busy trying to improve the legislation against quackery in Nigeria. They should be busy trying to checkmate the effect of the media, social media, and movie industry and music industry about how they project nurses in Nigeria generally, if they are really serious about the image. NMCN also said there have been some cases of malpractice with nurses that are trying to relocate abroad. There are cases of malpractice everywhere in the world, with the United States of America, with their own personal nurses that they've trained themselves, in the UK, with their own personal nurses that they've trained themselves. Are they frustrated their verification process because a couple of individuals have malpractices? Is that why the nurses in Nigeria should suffer this rigorous process? I mean, these excuses are not genuine. They have underlying ulterior motives, and that is one thing that everyone can see, really.
So is there a guarantee that any applicant will be verified after this procedure? The guidelines was issued or introduced earlier this year, sometimes in February. Have you seen colleagues that have been verified? Were they verified after applying for this verification?
Personally, I've not seen anyone who has been able to tell me they've been verified by NMCN since this issue started. So I mean, NMCN is just trying to, in their own way, reduce migration. Possibly, they are claiming that nurses are not employed. In Nigeria, we have several nurses that are underemployed or unemployed, and different people have said it. And I will continue to say it myself. If the government feels that nurses are leaving Nigeria and we don't have enough nurses in Nigeria, we dare them to bring out an advertisement trying to employ nurses and see the number of nurses that would apply for those positions. So that is a lie. Nurses are not short in Nigeria. We have enough. And if they want to prove that they don't have enough, they should bring out an advertisement and see the people that would apply for these positions. Can I also state that Nigeria as a country is sitting on the keg of gunpowder in terms of our health? Because apart from having nurses and producing them in their numbers, as a country, we have not invested in their development and in their education. In the health sector generally, we have not invested in this sector. And this JAPA process is as scary as it may be. It might be the future of Nigeria's health. And I will give you an example. I left Nigeria 2 years ago, and in that 2 years, I've become a specialist in my area of specialization. And who has paid for that training? The government of the country where I currently practice. In a couple of years' time, if Nigeria arranges everything well and things begin to make sense in our healthcare system, I, for example, and many of my other colleagues who have benefited from training and funding from a different government will come back to Nigeria with these experiences and bless our healthcare sector. So in that way, Nigeria has benefited where Nigeria has not really invested so much. And these are things that our leaders are supposed to be thinking about and looking at, and be thinking of how to make the environment more conducive for these nurses and healthcare practitioners in general.
What would you like to see going forward in terms of training, in terms of the verification exercise, the policy? Because I also understand that these policy, the guidelines, have been stopped by the House of Representatives.
First of all, I think people at the NMCN need to sit and have a sincere conversation with themselves. They need to be sincere. The foundation of all of this is lack of sincerity, and I think if they are not sincere about what they are trying to achieve, then there is going to be a problem. If you ask my recommendation, I think the whole new regulation needs to be scrapped in its entirety. They need to revert back to the normal process, right? There is nothing absolutely wrong with the normal process. And if they are really passionate about the image of nursing, passionate about moving Nigeria's health sector forward, they should be busy trying to employ nurses, trying to pay their foreign nurses well, trying to treat them well, and giving them a good working condition, good working environment. And with that, all the problems are going to be solved, and they will not have to be making very, very disorganized policies for them to keep things in check. I worked in Nigeria for 4 years before I left. And I once twisted my ankle when I was trying to run from patients' relatives. I wanted to visit doctors and nurses after they lost their patients. People suffer these things in hospitals, and we continue to say nurses should stay before. And is it when do you want them to stay until they are healed? They also have parents, they have families to go back to. Thank you.
Earlier in your response, you mentioned that you would love to come back to Nigeria to add value to the health system. I really wish did you actually mean what you said? And tell us your call to action.
Have you seen Nigeria? Nigeria is a blessed country. Have you seen the way we relate with ourselves? Have you seen our communalism as a country? Nigeria is a very interesting place to be in. We have a very wonderful weather. The call to action is NMCN needs to scrap that verification process. The government needs to invest in the health sector. The government needs to pay health workers, nurses especially, what they truly deserve and what their fellow governments in other countries are paying their nurses. Even in Africa, not even in UK, US, or Australia. And the nurses will be encouraged to give their best to their country, because despite the bad condition, nurses continue to give their best in the hospitals and outside the hospitals for patients and Nigerians in general. Thank you.
Nurses are extraordinary. Nurses deserve, not just nurses, medical officers deserve the best in order to give their best to back to the system. Toby Omolere, founder and coordinator, Nursing Conception Initiative. He is also a registered nurse. Thank you so much for your time and expertise on the recent nurses verification guidelines by the Nursing and Midwifery Council of Nigeria.
Thank you so much.
Sound Health continues with trending health report from around the world. Please stay tuned.
hello hello mami ẹ sọ fún alájà Zumba àti alájà Fọlámi ẹni kọ́ máa bọ́ ń ta dábàá ti dé ẹni kọ́ máa bọ́ ń ta dábàá ti dé sọ fún àwọn méjèèjì ok ẹ ṣe mà.
It is still Sound Health on Lagos Television. More to come in a moment. Well, this is why we say thank you on today's episode of Sound Health. Nigeria will be great. I believe in Nigeria. Nurses, doctors, wherever you find yourself, any field you find yourself, any spheres of life you find yourself, give back to Nigeria. Nigeria will be great. For comments and inquiries, or you have topics you would like us to treat, please send SMS to 0035826603 or follow us on social media at Lagos Television #SoundHealth. A sound health is a sound mind. Make healthy living your choice.